Vitamins and minerals are essential to maintaining normal health and metabolism. However, the real question is whether you benefit from getting more than a well-rounded diet would naturally provide. Well, a new U.S. Preventative Services Task Force evaluation has found the answer is no when it comes to preventing cardiovascular disease or cancer.
It's not unreasonable that we thought maybe we could take what we think are the healthiest components from fruits and vegetables, package them up into a pill, and hopefully they would work. In this case, we're seeing that that's just not the case.
That's Dr. Jenny Jha, an internist at Northwestern University in Chicago and the co-author of an editorial accompanying the newest U.S. Preventative Services Task Force finding on vitamin supplements against cancer and cardiovascular disease that was published in JAMA.
It's really showing that, unfortunately, vitamin supplements do not seem to be any sort of magic pill for preventing heart disease or cancer. We saw that the effects of taking a multivitamin on these outcomes were pretty minimal to no benefit.
Even more important, there is a downside. For example, excessive amounts of beta-carotene, a precursor to vitamin A, can contribute to lung cancer. There are also false reassurances.
Packaging vitamins into pills is not a shortcut, unfortunately, for eating a healthy diet, for exercising regularly, for maintaining a healthy body weight. If supplements are in any way distracting people from focusing on really adopting these healthy lifestyle behaviors, then that is an issue.
And finally, consider the cost.
At some level, if you're not really deriving any benefit from them, then it literally is a waste of your money. Now, one important exception the task force emphasized in their report was that there is very strong research supporting prenatal vitamin use, and particularly the role of folic acid in preventing certain birth defects. So what about people who might have a true vitamin deficiency? Well, that's an important point. And this recommendation is really intended for people who eat a well-balanced diet and do not have any known vitamin or mineral deficiency. If someone has a suspected deficiency in vitamin D, for example, it should be specifically evaluated and supplemented as needed.